Welcome back to Morning Joe. Live picture this morning of Reagan National Airport in Washington. The Wall Street Journal is reporting U.S. officials are considering a proposal to begin checking passengers' temperatures at roughly a dozen airports as soon as this week. This comes as airlines are increasingly requiring customers to wear masks in flight. The airline industry as a whole remains decimated, with demand down more than 90%, in no small part due to people's concerns during the pandemic of being in tight airplane cabins. But our next guest says that may not be something travelers should worry about. Joining us now, assistant professor at Harvard School of Public Health, Joseph Allen. Professor, it's great to have you on this morning. We'll let you explain your argument beyond the headline. I think a lot of people think of airplanes as these tubes that are tightly packed and that disease is bouncing off the walls and it's a dangerous place to be. What do you say to that?
Yeah, so it's a common misunderstanding. Turns out the air on the airplane is actually quite good, and we tend to think that we get sick on an airplane, but the reality is the airplane is actually a decent environment in terms of infection control, but we do get sick when we travel. That's because if you think about when you do travel, you do spend time on the airplane, but you also can't disentangle that from time spent in the airport, in security queues, at hotels, changing time zones, lack of sleep. All of these things are other risk factors, and we know this also influences our immune system. But I want to be really clear here. What I wrote about was the strategies that airports, airlines, and people should take to reduce risk. It is not a plan for when that happens. We need to curtail non-essential travel. I'm not saying everyone should rush out and jump on the next flight, but at the same time, we need to start putting in plans that can save lives and the economy. And if we are slow and measured in our approach for airlines and every other sector of the economy, we follow the science, just like your past guest, Senator Schumer, just said, and we put the health and safety of people first, I'm quite confident we can put in control measures that can keep people safe while we slowly restart the economy.
So what does that look like exactly, Professor? What does slow and safe look like in terms of the airline industry? Because I think most people just think, man, I'm not getting in a security line next to a bunch of people. I'm not getting on a plane, even if there are rows separating us. I'm just not taking that risk. So how do you get people over that psychological hump?
Yeah, I think a couple things, and people have to ask themselves these questions, right? Is it necessary travel? What is your personal risk profile? Do you have a pre-existing condition? How necessary is it for you to take that risk? And what's your risk tolerance? And also, are you willing to follow the rules that are put in place, to wear your mask, to keep distance from other people? Everyone has a role to play here. And here's what it'll look like. In 2013, I was one of the lead experts in a National Academy's report on infectious disease mitigation in airports and on airplanes. And we broke down recommendations for what airports should do, what airlines should do, and what people should do. On the airplane, like I said, the air quality is pretty good. You bring in a lot of air, and all of the air is filtered through a HEPA filter, a high-efficiency filter that captures 99.97% of airborne particles. I'm more worried about what airports are doing. It's hard to think about how they're going to handle queues at the security gate, how they're going to handle queues at boarding, how they're going to handle concessions. But there are things they can do, including these healthy building control strategies. Second, people have an important role to play here. Universal mask wearing has to happen. That is shown to be an effective control measure. I've written about this several months ago. In addition, if you look at the science on mask wearing in airplanes, it shows that you can reduce risk by a factor of 10 if everybody wears a mask. So that has to happen. For individuals, too, you have to be hyper-vigilant as you're going through the airport and boarding and on the airplane. And when you're at your seat, turn on the airflow, point it directly down. I think if we put in these layered defense control strategies, we can get to a point where we can reduce risk. Of course, there's no such thing as zero risk in anything we do. But for essential travel, we can slowly restart how we go about this if we're all really careful and take appropriate precautions.
Professor, I saw a study out of Europe that had similar conclusions to yours. I was pretty surprised about it. And can I just ask you a few questions about the inside of the aircraft when you're actually sitting in your seat? One of the things this research suggested was that because we breathe into the seat back of the person in front of us, in a sense that stops the droplets going to other people. But what I didn't understand is what about other surfaces, your tray table, the arms? You know, you might have two people get into that row before you. Potentially both of them have touched your area where you're going to sit. You know, when you're taking your luggage out of the luggage bin, somebody else might have touched that. What about those surfaces?
Yeah, it's a great question. And what we have to do is be really vigilant here, right? And airlines have to choreograph the seating so that we limit how much interaction has. I recommend that we stop in-flight service, so we limit how often the flight crew has to walk past everybody. And then in your seat, there are some things you should be doing. Like I said, you should be increasing the amount of airflow right on you and pushing down. That can help reduce the amount of airborne aerosols or airborne viral particles so that the air system can capture those. We should also be wearing a mask so that if we cough or sneeze, we're not projecting what we call large droplets onto other people. And then, of course, we have to be careful and vigilant in our seats. You should wipe down your surfaces with a disinfectant. You should be washing your hands frequently. You can't always do that on the airplane, so you should have some hand sanitizer with you. If you take these controls and the airlines do their part and the airports do their part, we can get to a place where you can minimize your risk and maybe feel a little bit more comfortable as you think about what that might look like for you if you have to take a trip in the near future.
You know, I was, Joe Scarborough here, I was thinking about starting to get a little more comfortable with the idea as we moved forward of getting back on a plane and traveling again with all the safeguards you mentioned. Then I heard an NBC doctor, Dr. Fair, who took all the precautions on a plane, ended up with COVID-19 and thought he may have contracted it through his eyes. What's a possibility of that? And if you can contract it through your eyes, should we all look like Kareem Abdul-Jabbar on planes and wear goggles?
Yeah, so it's an interesting question, and I'll address it in two ways. Thinking about the systems on the airplane that can actually help. And you know, I know when people do get sick when they travel, right? My argument in this piece is saying, look, if you look at the science here, it's unlikely that it's happening on the airplane. But there are many other ways you could get sick in your travel. Maybe you took a taxi, a bus, public transportation, stayed in a hotel, stayed with friends, didn't sleep well that night. All these things contribute. In terms of exposure, even through the eyes or nose, there's a suggestion that that's possible. Right now, we understand it as the main route of transmission is through the mouth of the nose. But still, if you think about what's happening on the airplane and these healthy building strategies which apply to airplanes, it's just a unique indoor environment where we spend our time, higher ventilation rates can decrease the amount of airborne virus, right? It's really straightforward and logical. It dilutes the amount of virus that's in the air. If you're doing that and you're controlling the airflow, and if airplanes have gate-based ventilation on, which they don't always do when you board the plane, which is surprising and needs to be corrected, we can minimize how much airborne viral particle is floating around in the airplane cabin. So when the system's running well, and when it's on, when you're boarding, you can dilute that concentration. Anything that gets pulled into the exhaust system for the airplane runs through a HEPA filter. So all of those viral particles are captured. So that's really the first control strategy. The last line of defense is PPE, and that's mask wearing and potentially, if the science bears it out, some protective goggles.
Finally, and very quickly, Professor, would you get on a flight right now as a healthy man from, let's say, JFK to LAX? Would you take that flight?
I think the first thing I would do is ask myself, is it necessary? Do I really need to be on that flight? Look, to be very clear from the public health standpoint, the best way to protect yourself, your family, and others is to stay home, unless it's essential travel at this point. If I had to travel, I would feel comfortable. I know the steps to take. You can read the article that gives you tips on what to do. I'd be making sure I was hyper vigilant in hand washing and maintaining physical distance in the airport and put those controls in place. So if I had to do it, I would do it. I would also encourage people to evaluate their own risk tolerance and also think about their own personal risk factors. Last, I want to say this. While the airplane environment is safe for transmission, airplanes are a vector for disease. So they're really effective at moving people around the country and world as a way to bring disease. If someone's sick, potentially bringing that to a new area that may not have an outbreak happening.
All right, Joseph Allen, assistant professor at Harvard School of Public Health. Thank you very much. He's also the co-author of the book, Healthy Buildings, How Indoor Spaces Drive Performance and Productivity.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.